Welcome back. This is Didy, and this is Week 5, Lecture 2, Part 1. Now we're talking about the integument system. So the integument system, you probably know it as the skin, is the largest system of the body. So when you get that quiz question, if you go to quiz nights, what's the largest system of the body or the largest organ of the body? It is the skin, the integument. Covers 16% of the body weight, and if we were to put it out on a flat area, it would be between 1.5 to 2 square meters in area. It's made up of 2 parts, and we're going to look at these more closely over these next 2 lectures. So we have the cutaneous membrane, the skin, and all of the accessory structures. So the 2 components of the cutaneous membrane, we have the outer epidermis. So if you see epi and see the E, think of exit, think of outside. So outer epidermis, which has superficial epithelial tissue, and the inner dermis, which is made up of connective tissues. We're going to talk about the accessory structures that originate in the dermis, and then they extend through the epidermis to the surface. And these include the hair, the nails, and the multicellular exocrine glands, such as the sweat glands. So the integumentary system has connections with the cardiovascular system and the nervous system. With the cardiovascular system, we've got blood vessels in the dermis, and with the nervous system, we have also got mecrine receptors that have sensory receptors, fortunate for us, for pain, touch, and temperature. So this is a protective mechanism. We'll talk about the nervous system and the skin a bit later. So the hypodermis is the loose connective tissue below the dermis, and it's where we have the location of hypodermic injections. So you as a registered nurse, if you're giving a hypodermic, so it's below the dermis and it's probably into some fat tissue. Or if it's an intramuscular injection, then it would be going into the muscular layer, but it's going below the dermis. So here's the diagram similar to what you've got in your book, and you can see here we've got the cutaneous membrane divided into the epidermis closest to the surface, and then the dermis, and then the hypodermis. So you can see if you're putting a needle through the skin, it needs to be long enough to be able to go through the epidermis and the dermis in order to reach the hypodermis. Let's look at the functions of the skin. Of course, they protect us from abrasion and from water loss. The water loss is really vital if you're looking after a person who has been burnt, because of course the burning will take away the layers of the skin and that person will lose water immediately and will continue to lose water until that skin is replaced with either a waterproof dressing or with some other form of skin. We have artificial skin, and we also have skin grafts from other parts of the person's body, or we can have xenografts, which are skin that's been taken from a person who has died and has donated their skin to science, or not to science, to the healthcare system, and their skin can be harvested. So the skin also protects against bacteria and ultraviolet radiation. It's involved in the excretion of salt and water in the form of perspiration. It helps us to maintain body temperature by the mechanism of shivering and sweating. It produces melanin, produces keratin on the soles of our feet and on our hands. It's involved in the synthesis of vitamin D. It's involved in the storage of lipids, and it helps in the detection of touch, pain, pressure, and temperature. All protective mechanisms.